just like hot. When I am moist in my pits, it airs off. It airs off. Hello guys, welcome back to my channel. All right, let's talk about what it is we're dealing with right now. Definitely some trying times. Let's not say the evil word of what has caused all of this, but let's just say it's very difficult right now, okay? We're going through a lot, all of us. But in regards to the dental field, definitely a lot of stuff going on. A lot of us can't even work right now, especially hygienists. Let's talk about PPE a little bit. So with PPE, I feel like, you know, with some offices, they can be very strict and on the book, and some are a little more like, no, like we're not going to follow the book completely. But this whole situation that we're going through right now might completely change how offices approach that. I know that I've had an office where I didn't have to wear a surgical gown for every procedure. Like I just wear my scrubs and it's fine. And that could depend on maybe whatever procedure you're working on in that office in regards to if you have to wear that or not. But definitely there was another office I worked at that you were required to wear all the time. Walk around the whole office and just wear that the whole shift. So it could depend on how your office is ran and what they require. But definitely it is a requirement to wear certain PPE protection. Does everyone follow that completely? Maybe not. But one thing that we can know for sure after all this is that this could change how strict an office can be about it. Like I didn't really wear a face shield before, and now I'm like, well, we might have to now. And definitely the type of mask that we wear, whether it was a level 1 that you maybe worn in an office or level up to a level 3, I believe, that might change where the ADA is going to require us an N95. Or maybe that can be only required with hygienists. I don't know. I don't know what's going to happen. I don't know what's going to change. I know this is all very scary. And I think we're all starting to get a reality check as to what we're exposed to. We're exposed to a lot and we're inhaling a lot. So it's kind of like reminding us that PPE is important, and it's important for our protection as well as exposing others with whatever it is we're exposed to at work. So it's kind of interesting. So I am fabricating a course, and I will keep my YouTube channel notified when it's ready to be posted, or when I'm gonna post it, or whatever it may be. But definitely the last thing I'm gonna be filming is the PPE, because that could change, and I'm gonna stay up to date on the ADA website, as well as maybe other forms of, like maybe the CDC or whatever, if they discuss dental requirements. But I will definitely stay updated and film a more updated protocol when it comes that time. I'm really working on filming that as quick as I can and getting the course done, but I'm gonna film that section last. Say hi to Maya. She loves me and I love her. Hi. So let's talk about uniforms in general. I don't know if you noticed that there are some offices where they're very strict about scrubs. Like you have to wear scrubs no matter what. But then there are some offices that want you to kind of wear like maybe a scrub bottom and then like a cotton t-shirt on top. And then maybe some offices that want you more of like that almost professional look, like what front office would wear, but obviously more coverage, where it's like not scrub bottoms, but they're like the stretchy type pants that are almost professional looking. I think you get the gist of it. As well as a cotton t-shirt that kind of has maybe the logo of the business or something. That definitely was something that I had to wear before, and I'm so glad things changed. Like, let me tell you, my hormones, I sweat a lot, okay? My pits are moist a lot at work, especially because we don't pump that AC because we don't want to freeze our patients out, but we get hot back there, and these pits stay moist, like gross. Ugh. And whoever gets triggered by the word moist, I'm sorry, maybe I should put a warning at the beginning of this video, but I apologize. I like that word, it's fun to say. But basically, yes, so I used to have to wear that. I used to have to wear a cotton t-shirt, that and the type of shoes that we had to wear that kind of went with, we couldn't wear like regular tennis shoes because they looked weird with the type of pants that we were wearing and the shirts we were wearing. So we were like, we had to wear these like kind of ballet flats almost, was most of the time that was approved. We couldn't wear Converses, that was definitely a no-no. I tried getting away with that for a little bit and that didn't work out, but we had to wear like ballet flats most of the time, and those are just not okay. Like if you think about it, the exposure we have with splashing of saliva mixed with water and it just gets everywhere, it splashes on your feet, and oh, the moment you feel that splash your foot, you're just like, oh, like gross. So I am so glad I don't have to freaking wear that crap anymore, and that we're wearing normal scrubs of a material that breathes, so when I am moist in my pits, it airs off. And if it doesn't, I go in the lab and use a little blow some air there. Anyways, so discussing uniform, every office can be a little bit different. This might change, however, in the near future. But if at any point you're at an office and you feel uncomfortable with what it is you're being forced to wear, just find another place. And if you're worried that you won't be able to find another place, we're going to run into any type of job difficulties or being able to find a job, you want to keep the one you have, just discuss it. Discuss your concern. Bring this up to management or the owner or even the dentist. Express your concern and that you feel uncomfortable and you don't feel like you're completely protected from everything that's happening in the back office and what we're exposed to. Just communicate. Let them know. That's all I have to say. I hope you're all staying safe out there, and we're all in this together, and we're all dealing with this crap together, and I really hope that you guys are trying to stay happy as much as possible. I know that's difficult when you're feeling trapped inside of your house. I will say something that helped me out a lot is just getting creative. I do have painting supplies, so I've been painting. I was painting a couple masks. I was using push-on or stick-on nails. It only took me a minute, so that's not too much creativeness. Focus! Anyways, stay safe everyone. I hope you're having a fabulous April, and I'll see you soon.